Excellent. You know, Kevin, as we were saying earlier, unfortunately, even though people know that it's not good to smoke, and we know that, yeah, there are some vaccine-preventable diseases, but people still choose not to get a vaccine, even seniors who are at highest risk, are there some activities that happen at the local health department that you do to address some of that? How do you try to keep motivating people to make healthy choices?
Well, that's really what we do. I mean, and a lot of it is invisible, behind the scenes, which in some ways is good because we may be having an impact, but in some ways is bad because people don't really understand what we do because of the invisibility. If we're doing our job right, we're protecting people, we're preventing disease, we're promoting healthy behaviors, much like the tagline on the logo.
Right. Prevent, promote, protect.
Prevent, promote, protect. And so, you know, we're trying to prevent disease, we're trying to prevent people from starting smoking through doing promotional, educational efforts. As Dr. Gotch says, working with other people in different areas to get these activities going and implementing change in people's behaviors, whether that's preventing them from starting smoking, or working with the quit centers and other partners to get them to stop smoking. So there's a lot of those. And you talked about the immunizations, and it's not just immunizing against flu, which is so important because we know so many people die from influenza infections every year. It's a major problem, and we really want to get that word out and work with as many different people as possible to get them immunized, but also immunizing children against preventable diseases so that we don't see the diseases in the community. So there are a lot of activities that are going on.
Now, you have mentioned, and I'm aware of, essentially well baby clinics, what we might refer to as that. How do they work in the community to help ensure that all children are eligible and have access to vaccinations that may be needed?
Yeah, I would say that the majority of children are covered by their private physicians, and their physicians work with the families to ensure that the right vaccines are given and the right preventive care is given. But there's a significant portion of our population that either don't have private physicians or don't have appropriate insurance coverage, and so we provide those services to cover those gaps. And that's where our child health conferences, well baby clinics, come into play, and getting those individuals who don't have access to health care and other avenues to the right immunizations and care.
So really, public health in a sense, although we think of it, focusing on the health issues, which of course it is, but it's really a safety net too. I mean, there is an economic safety net that's provided.
Certainly governmental public health fits that role, yes, absolutely.
So even, for example, the well baby clinics, are they available if someone has no insurance whatsoever or inadequate insurance? Is it available low cost, no cost? Both?
Our clinics are no cost and cater to those that have no insurance or inadequate insurance.
So it really does provide that catch for people. What sort of, when we talk about containing spreads of disease and infectious disease outbreaks, communities that public health typically serves, we think of it as a city or a town or a statewide level, if that's the case in something like a state health department. But there are other communities that you serve, much more contained communities, right? Like a school or a nursing home or, some other sort of contained environment, a contained population. What role would you typically play if there was, say, a disease outbreak or an infectious disease beginning to occur within one of those sorts of environments? How do you address those?
Particularly in this case, I like to talk about the health department being analogous to a police department. I mean, we're really the detectives that are going out and identifying the diseases and where they are and where the cause of that problem is. And so that's what we do. We go into whatever that environment is, whether it's a nursing home or a school or the community at large. And in fact, we recently had a small outbreak in a long-term care facility. It was identified by one of my employees, health department, looking through surveillance measures at disease. She happened to see an anomaly, identified the disease. We contacted the facility and started to put control measures in. We worked with our state and federal partners, the state health department, the CDC, to put in control measures in the facility so that it didn't spread. Isolation measures for those that were sick, quarantine measures, and hand washing and testing to make sure that everybody was screened for the disease, and ultimately controlling it so it didn't spread.
Excellent. And so that the surveillance that you mentioned, I think that's probably a very critical piece. Is it accurate to say that you do routine surveillance in those sorts of communities so that this anomaly stood out? Is that
sure? In all communities, whether it's the general population or if we see something going on in a long-term care facility, or if the school nurses that we work very closely with report to us that they're seeing an increase in a certain, whether it's influenza or chicken pox or something in the schools, that all gets reported to us, and so we can help and work with them to correct the problem.
And sometimes the cause of the problem can come from outside of our state. Remember the E. coli situation we had a year ago?
Absolutely.
With the spinach that went out to many, many states. And the same thing had to happen state by state to find out where the spinach had been distributed and how it was impacting the health of those living within that community.
Absolutely. So without that kind of surveillance happening routinely, and without those sorts of tracking systems that can track where food is being distributed, it would the dots wouldn't be connected, would they? Outbreaks wouldn't be recognized as quickly if we don't know what the baseline is.
Yeah, and I think one of the great advances, although we don't talk about it as a public health advance typically, but one of the great advances that we've seen over the past few years is our ability to communicate and collaborate. And examples like the E. coli are good for that, because it's a testament to the communication amongst the states, amongst the local health departments, academia, identifying things and being able to communicate all of that information very quickly, that we're able to control things in a much more efficient manner.
But it also points out the importance of the infrastructure of public health and how we need to keep that infrastructure in place and the trained personnel, because without that, you wouldn't have the surveillance system, you wouldn't have the connect and the linkages with the other communities that we really need to have in order to quickly take care of something before it gets out of hand and really causes more damage than it would if you're able to contain it.
Yeah, which again goes back to kind of the invisibility of public health. All this activity is going on behind the scenes, communicating to stop it before it becomes a problem.
Right. It's so hard to measure sometimes, although granted public health is all about statistics and monitoring and looking at data, but the absence of something is very hard to communicate to the public. Gee, when you take a glass of water from your sink, you can trust that that water is safe because such monitors are in place. The food that you eat in a restaurant is safe because there are inspectors who go out and make sure safe food handling practices are happening. And it's very hard to convey that lack of a problem, right? Otherwise, it's suddenly taken for granted, and people don't think about that.
To thank somebody for something that didn't happen.
That didn't happen, right? Who does that?
Because you don't realize it didn't happen because it was prevented.
That's exactly
and
right.
there was really a lot of work went behind that in order for that not to occur.
Right.